The show because I just want to follow this my whole life. Just want to read the first stanza. कर्मण्यवादितारस्ते मा फलेषु कदाचन मा कर्मा फलहेतु पूर्वा माते संगोस्त्व कर्मणि. That means everyone knows here कर्मा मानो फलದ ಚಿಂತನೆ ಕೃಷ್ಣ ಹೇಳಿದ್ದಾರೆ. This is my index. This is what brief introduction to laparoscopy. Minimal access surgery is popularly known as keyhole surgery. In 1901, George Kelly from Germany performed first laparoscopic procedure in dogs, and in 1910, Hans Christian from Sweden performed first laparoscopic operation in humans. The first publication on modern diagnostic laparoscopy by Rolf Palmer appeared in 1947, followed by publication of Hans and Kurtson, who both practiced pseudo-hysteroscopy from the 1970s. This is regional history. You can see that is my Appaji who is doing the surgery. He used to go like that before. It's been almost more than 35 to 40 years. Our respected senior surgeons are practicing keyhole surgery in our region. We are very fortunate to see them among us and guiding us, boosting our morale in difficult times. These are the statistics since 4 years which we could operate few of the cases. TAPT, that is transabdominal preperitoneal menstrual tape, and some other cases like appendicectomy, appendicular mass, cholecystectomy, ectopic pregnancies, and periphery. These are the advantages of mass, that is minimal access surgery. The beauty of laparoscopic surgery is these have small incisions ranging from 3 mm to 12 mm or up to 15 mm. As the incisions are small, it has got lesser pain, lesser wound infection, and lesser infection because as the wounds are very small, so the infection is very lesser, which are localized to the sites. And always better visibility of the internal organs other than targeted organs. That is, if you are operating on appendicitis, you can always see other organs just go through all the cross examination, and if there is any diseases which we encounter on table, we can address them as then and there only by biopsy, but only after taking the consent of the patient. Next is ERAS. ERAS is nothing but enhanced recovery after the surgery. That is very big. That is because the incisions are smaller, handling is less, hence patient is mobilized on the same day, can be discharged on the same day, allowed orally on the same day. So the ERAS is very good compared to OPC. Yeah, as all the surgeries, all the procedures, these have also the limitations and difficulties. First and foremost, creating the pneumoperitoneum, that is CO2 insufflation. It is very difficult for the most experienced surgeon, as you already saw Naz madam. There was a mesenteric injury while doing the pneumoperitoneum, and it is a nightmare for new surgeons like me. And the next limitation is tactile feedback of the tissues or organs. As in open surgery, we can always feel the tissues which are fragile, soft, hard, but in open laparoscopic surgery it will be difficult. And next also, because we rely on remote vision and relying solely on the camera assistant. If the camera assistant is not good, yeah, the surgery is good. So also the next temptation is achieving hemostasis. Also again, as we have showed that mesenteric injury, even the best of therapeutic surgical units, we still can't control the bleeding sometimes. So that will be the one of the main reason to open the abdomen and deal with it. Next is inadvertent injuries. Again, it happened like that, so it happens to everyone. While inside in the port, we injure the bladder, we injure the aorta also, and it has happened. We have injured the bowel, large bowel, colon, everything. And while inserting the instruments through the port, we have injured a lot of organs while on the way. Yes, learning curve, it is steep compared to open because it has hand-eye coordination and it's a good mentor for us, a good laparoscopic unit, everything. And one more thing, most of these surgeries are performed under general anesthesia, or I prefer general anesthesia, but we have very competent anesthetists among us who guide us through the spinal anesthesia. Also, we have done a lot of cases under spinal anesthesia, tuberculosis, appendicectomy, all the cases. Thank you for that. Cost of equipment. Yeah, this comes here. Cost of equipment are very high, ranging from 20 to just name the price. It is a 70, 75 lakhs, 80 lakhs, wherever you can go. So, luckily I have a very good financial supporter with me who can provide me all kinds of these gadgets with me to play around. So, I'm lucky to have it. Rest of the complications remain as a process. Yeah, coming to near-acute setup of minimal access surgery, good and supportive anesthesia. Good and supportive anesthesia means not only a good anesthesia, but also on the moral ground he has to support on table. Like young surgeon like me, they have to be very patient, very tolerant, because most of the times we lose our patients, but they don't. They always stand with us, guiding us, and their set of eyes are different, different than operating surgery. And a good laparoscopic equipment like HD camera, LED source, smart insufflator, good anesthesia workstation, everything comes under that setup. A good camera assistant. Yes, good camera assistants are not found in the market. We have to train them. They are brain sync with us. They are like our eyes which are outside the socket of our outside cameras. They see, we send the signals to them. It is that good. And online videos exclusive to the operation theatre, not only for minimal access surgery, it is advice to all the surgeons here, surgical fields. It is very important because while operating, if something goes off and the monitor goes off, if there is a severe bleeding, you have to open invariably. When if you open, there is no OK light there. So, and also the second advantage is the damage to all the costly machines is reduced because of the fluctuation of electricity. Next, spacious wall, backup surgeon. This is most important. Again, I am very lucky to have a backup surgeon. Not only an experienced surgeon, but a surgeon who has a new set of eyes. Even a newcomer as a surgeon, if you call him for example, his eyes, his way is totally different. So he may help you in it. This is our OT setup. As you can see, all the equipments as I told. Complications and fate, this is just out of the this one. Not all surgeries are happy ending, hence they are called as complications. Not all complications are due to negligence. Some are due to unknown factors, hence it is called fate. Sitting here, each and everyone, not only surgeons, including physician, anesthetists, everyone have encountered with the entity known as gap syndrome. Each and everyone. Nobody is at fault, but everybody is at fault. We don't know what is happening, but the patient is suffering there and still we can't do anything because it is happening there, just happening. We don't know why it is happening. Now, coming to awareness. Among general public, talking to our patients, convince, counsel, tell the benefits of the procedure. Our purpose is to add the word complications. Tell lesser complications to the patient. If I tell the patient, you will be operated under general anesthesia and you may not come out of the general anesthesia. The patient will just not out the OPD. He will never say okay to something. So just tell them what are the benefits of the procedure. Rather than telling the negativity, just tell them the positivity, but what are the good things about the procedure. And post-operative pain, tell them it is very lesser pain, they will be very fine. Yes, pain of the surgeon, this is encounter and experience, this is the experience. One patient I was introducing it for the laparoscopic surgery. I just asked him, I said, millions are not easy, the machining machines are not. I told him the pain of the surgery while I was doing, so I was happy actually. He said, what is it? I said, in this customer, maybe it is really beneficial to the patient, that is why you are operating. So pain of the surgeon, I will make happen to the patient. It's like their knowledge of minimal access surgery. Like phobias, fear, resentments. Phobias means patients, lot of the patients have phobias that post-operative laparoscopy, they are quite certain. And they fear that one patient had told me that after laparoscopy, the appendix has grown back. Here the liver doesn't grow, but appendix is growing. And recurrences. recurrence. Only operated by the technical then recurrence very less. Expense of the surgery, yes, we have invested too much. We obviously extract some money from the patients, but it is a one time. But the thing is, what we have made in our hospital is we have just made the laparoscopy and open at the far of the open surgery. The prices are almost at par. We don't charge more for laparoscopy. Only in case of general anesthesia we charge more and drugs. So that we have done. Among the medical professions, yes, lot of non-surgical people or surgical things. Convince yourself first, and then your patient or others. We have to convince ourselves that laparoscopy is one of the beautiful modality which is available in the periphery, done by all the competent surgeons, almost all the competent surgeons. It is like the ABC of the surgery nowadays. So all the surgeons are doing laparoscopy. Convince yourself that is one of the best modality you can offer to your own patients. Patients will be definitely happy once they go out of hospital. Almost all surgeries can be completed, attempted and completed through MS except sterile sections. Encourage your patient to avail this beautiful technology. These are ruptured ectopic primary who presented with ruptured ectopic. You can see the embryo there. So it was intra-abdominal, it was just feeding on the momentum which we could do. We could not find where was the rupture, but there was a bleeding. It was just sitting on the intra-abdominal. So we could do this. RIF marks with surprise. Just waiting, as Madam said, but our radiologist had given people with the collection on the appendix, so I could just a surgery. I also found the people, so just maybe as a surgeon or like a fool, just went on operating. And that day I was out there at in town. What to do? I did all the surgeries. Here you can see the people. I just operated, thinking that that could be the appendix. And before closing, I just wanted to do was re-survey. Just was doing the survey. Yeah, there I could find the appendix. So it was a very surprising and very shocking things to me, because I thought I was operating on the appendix, but I did not. I was not operating on the appendix, and the appendix is totally different. Retrospectively, then I got to know that it is cecal diverticulitis. So I just did, I asked the consent for ectopicolectomy, but the patient did not consent for me. So I just took my chances and sutured the cecum and kept it in. I took my chances. The patient went very well, and I again subjected them for the colonoscopy. There was complete diverticulitis all over the colon. This is one more ruptured ectopic with a normal pregnancy. Yeah, you can see the left hormone. She was a primary. The beauty of laparoscopy and ectopic pregnancy is it is hardly a 10 minutes procedure, and we just dilate, we take out everything. The thing is, the beauty is we give beautiful lavage everywhere. The lavage is so good, you can just see end of the surgery that we are not able to see any blood there. But in open, there is a lot of handling, everything. Large indirect bilateral involved hernia. You could offer. do laparoscopic surgery for him. After 12 months of follow-up, luckily he has not come with the recurrence. Lucky for him and lucky for me, I don't know. The future is upgrade, accept and change. Change is the only constant thing in this universe. So we have to accept the change and we have to upgrade ourselves. There are a lot of obstacles or things are coming on the way, like robotics, AI, augmented system, nanotechnology. But at the end of the day, human instincts remain the ultimate. Take home message: we should get abreast, update, adapt to newer technologies. Best comes with great price. इतने पैसे में उतना एज मिलेगा. Thing is, we cannot reduce the price and reduce the quality of the patient. We have to give the best quality at affordable prices. We can't keep ourselves at the stage. So, thank you all for